Shelter medicine, I did home hospice and euthanasia exclusively. So compassion fatigue is something that is near and dear to my heart, as well as euthanasia, obviously. So that's kind of why I've been picked for this topic. It's okay. I like to have my notes with me, so just so you aren't looking at paper over here. So, like I was saying, I'm a new grad. My first job outside of that school was immediately doing euthanasias. I probably did between 6 and 7 a day. That was a normal day for me. And of course, I did hospice as well, but we all know that hospice is not intended to extend the length of a pet's life, more like getting them comfortable. So those ultimately end in euthanasia as well. So what I want to do today is kind of talk to you guys about what compassion fatigue is, as well as some other names and definitions that you might come across when you're talking about it. So we're going to talk about how we recognize it, how we're going to treat it, the prevention of it so that we don't even have to go down this road of compassion fatigue. And I'm going to give you guys some resources as well. And then I'm briefly going to talk about the suicide crisis that's kind of hit veterinary medicine. It's something that's a little personal to me as well because it's affected my family. And then after we get through compassion fatigue, we're going to talk about appropriate euthanasia. So I'm not going to tell you guys specifically when is the right time to euthanize. What we're going to talk about is more of the technical aspects. So the drugs, pre-sedating, what route are we going to use, those types of things, okay? So let's get started with the different terms that you might hear. Burnout is one that we hear most frequently, and that one is more of our cumulative grouping where we're just exposed to so much at one time and we just get exhausted about things, right? And then the next one is ethics fatigue. So this is where what you believe is right and what you are doing are not connecting. So it's a mismatch between what you believe ethically to be correct and what you are doing. And then the last one, of course, is compassion fatigue. And this is going to be our prolonged exposure to highly traumatic events, right? So this used to be called secondary traumatic stress. It came from human medicine, and it was associated with nurses and doctors in an emergency room. So it's kind of where this got its start. So we're going to get a little more into detail here about burnout. I've already mentioned to you guys that this is a cumulative process. It's the result of constant stress in the work environment, increased workload, versus compassion fatigue, which is traumatic stress related, right? So some sources of stress that you guys might have in your life are going to be your interpersonal relationships at home or at work. Maybe it's financial problems, or the classic shelter one I hear is so-and-so didn't come to work and now I have to clean 50 cages instead of 25. So now you have that going on. Burnout usually manifests as physical and emotional exhaustion. Anyone in vet school right now probably is experiencing this full blast. Physical exhaustion, of course, is going to be you're very tired, you don't have a lot of energy, maybe you start seeing an increase in being sick, so like you have colds and flus more consistently. And then emotional exhaustion, that might kind of manifest as negative feelings towards coworkers or classmates or whatever. Maybe something that I see a lot of is people start losing their patience very quickly, especially when it comes to the animals. You know, if Fluffy's not moving fast enough or doing something crazy, you might get a little less willing to deal with it. And then a lot of times people will kind of withdraw completely, and then you kind of don't understand what's going on with them and they've just stepped back. Ethics fatigue, this is the mismatch one. This is something that we hear a lot of with veterinarians, but I personally believe that anyone in animal welfare or shelter is going to experience this. And like I said, it's not a loss of compassion, it's more a mismatch between what you ethically believe to be the correct thing to do and what your actions actually are. So the best way for me to describe that is a scenario of two veterinarians, let's say. One is the owner of the clinic or the boss, and the other one is the employee. And let's say the employee sees a case and it's clearly an abuse case, and we can dive into the forensics of it, how you can prove an animal is actually being abused. Let's say we've done that and we know it is. And that person wants to report it to the authorities, but maybe the owner or the superior doesn't want to because there's publicity that comes with that. There's the possibility of going to court. There's what other people are going to think about you in the public. So now this other vet is stuck with being told that you can't report this because I don't want this to happen and you don't own the clinic, so you have to do these things, right? So there's an ethical dilemma there between what that person knows is the correct thing to do and what they are being asked to do. And then, of course, compassion fatigue. And I already told you guys this was first called secondary traumatic stress, and it was associated with nurses and doctors that were being exposed to really traumatic situations. You know, people come in from accidents or whatever, having really traumatic events, and now they're dealing with the repercussions of that event. You know, people are emotional in the ER. We're having all these other things that are going on that we're getting exposed to. There's a thing called the American Institute of Stress. Did you guys know that? That's a thing. And they describe compassion fatigue as the emotional residue or strain of exposure to working with those from the consequences of traumatic events. So I want you guys to think about what that means for us as animal welfare workers. So let's think about, it's just been kitten season, right? And there are bazillions of feral cats where I live in Mississippi, and they notoriously get hit by cars, and people bring in litters of kittens. And now we're nursing a bunch of kittens, right? Or how about a dog who was brought in by animal control, it was tethered to a tree, starved, and it has an embedded collar in its neck. So you guys can see how those events, I mean, they're affecting you just hearing me say it, and those events are going to affect us, right? I do want to say, though, that compassion fatigue or compassion stress is sort of an occupational hazard for us, which is why it's so important for us to be able to recognize when we're slipping past that point of the stress part and we're getting into the compassion fatigue syndrome. I see that. I love this quote, and when I wrote this is actually a lecture I gave at a shelter conference that my university held, and this quote was something that I felt very relatable to all of us. The expectation that we can be immersed in suffering and loss daily and not be touched by it is as unrealistic as expecting to be able to walk through water without getting wet. I think we all can probably relate to that. So the first step when we're talking about compassion fatigue is to recognize that we even have a problem. So check in with yourself. You know, how are you feeling? How are you guys reacting to certain situations? Are certain, you know, maybe you're having interactions with people and certain people are like triggering you, things like that. These are things that we need to start paying attention to. Some of the clinical signs that we are going to see, lots of emotions. We're going to have emotional outbursts sometimes. It could be aggressive outbursts. It could be like intensive crying. When I was going through compassion fatigue, I was super emotional about everything, and I would just burst into tears. My parents were like, "What is wrong with you?" Well, there was a reason for it. Isolation from others, missing work, skipping classes, things like that. Excessive complaining. Well, I'm sure we all have experienced that. But on the flip of that coin, lots of complaints are being made about you maybe. So that's also a kind of mirroring thing where those might be signs that we're seeing. Some people tip over into substance abuse, so drugs and alcohol, things like that. And then the other one that sometimes we see is poor hygiene. People kind of stop caring about themselves in general. Those are signs that we'll see. There are a couple of things, too, that make a person a little more likely to tip into compassion fatigue. One is having a highly empathetic personality. Everyone in this room has a highly empathetic personality, or we wouldn't be doing what we're doing. So that's unfortunate for us. The second one is having a history or experience, or having history or recently experiencing personal traumatic events. Those types of things kind of already tip you over onto that scale, so you're a little more easy to fall into compassion fatigue. So now that we know how to recognize it, what are we going to do about it? And the best thing that we can do is learn how to manage our stress. So the first thing I always tell everybody is talk to somebody. I don't care who it is. I don't care if it's a classmate, a coworker, a priest, a rabbi, a friend, a stranger on the street. Just talk to somebody. Everyone in this room has gone through difficult times, and everyone in this room can give you advice and help you. Use those resources. Absolutely. We are a tight-knit community of people. Just reach out. The second thing is going to be to take a break. Now, I realize that it's not possible for all of us to just take days off. I call them mental health days because sometimes I just need a day off. And I know that's not always possible, or if you do take a day off, like when I was working hospice and euthanasia, even on my days off, I was receiving phone calls and text messages from hospice cases, from my coworkers asking me if I could euthanize a dog that night because they had to do something, whatever. So it sometimes can be really difficult to completely unplug from work, but I want everyone to at least try. Even if that means only for 30 minutes. Go for a run, go to the lake, go fishing, whatever it is that you can do for 30 minutes by yourself. You need to take that time for yourself. The other thing is, try not to take work home with you. Again, it's been kitten season. I brought home a ringworm kitten, and my house is now infested with ringworm. And I shouldn't have done that. I should not have brought work home with me, but I did. So my biggest thing I would offer, or try to have everyone do, is don't take that home if you can. Now, I understand, I see you laughing, I understand that sometimes you gotta bring the babies home and feed them every 2 hours. You have to do it. Maybe don't do that every 6 weeks. Maybe we could do that. So the next thing for managing your stress and compassion fatigue is set boundaries for yourself. So discussing hot topics. Euthanasia is a hot topic. So if you are going to go into, let's say you're a vet and you're going to go into working in a shelter, and maybe you don't want to do euthanasias every day. Well, that would be a discussion that I need to have with that shelter and say, I don't want to be the sole person that does all of your euthanasias. So those are the types of things that I want you guys to be thinking about. It's really important for us to create safe work environments for people. If someone is not able to be open and honest with you in the work environment, that's going to create a lot of stress and a lot of interpersonal stress, and that's only going to worsen the situation. Also, it would be wise to have set protocols for certain things. So, God bless you. So, for euthanasias, for instance, maybe have a set protocol on what is going to be the defining moment for euthanasia, right? So, we talk about a litter of parvo puppies coming into the shelter. Do we want to humanely euthanize them, or do we want to risk getting everyone else in the shelter sick with parvo? If there's a set protocol where we know what the answer is going to be, that takes the stress off of everybody else, and we don't have to make that decision. The decision's already made for us because of biosecurity, because of our intake protocols, or whatever it is that we have set in place. So I really recommend doing that. I know some of you, we'll talk about this in the euthanasia portion, might be certified euthanasia techs, and you have to be the person in the room that's euthanizing all of the animals. Again, that's where I would really stress having a set protocol in place, but also have a good relationship with a veterinarian. If you have that and you're able to work with them, maybe you don't have to be the one that's consistently doing the euthanasias. I know some of you, 2 of you raised your hand when they said there was no vet within the county. You know, that may not be an option for you, but still I would work with a vet to get a protocol in place. That way you're not having to make those decisions yourself all the time. So of course, self-care is going to be the best way to kind of mitigate all of this, right, just from the beginning. So taking care of your physical health, that's going to mean exercising regularly. I did kickboxing in vet school because that was the only way I could get rid of that stress. Now it's more yoga, but sometimes kickboxing. Eat healthy. I ate a lot of Girl Scout cookies. I'll admit that. Of course, drink a lot of water. Get lots of rest, right? I can tell when I've had 4 hours of sleep versus 6, so it does make a difference. And then mental health. Always have a good support system around you. I have, where I work, and where I worked in Florida as well doing euthanasia, I had a really great group of people who we could reach out to each other at any time when we were struggling with something, and that's super helpful for sure. Know when to ask for help. If you feel like you're depressed or sad or something's really bothering you, just reach out for help. Everyone's here for you. We are a said it before, we're a tight-knit community and we're all here for each other. I mean, I know if I called Amanda tomorrow, she'd be here if I needed her. Remember to set personal boundaries, right? So if something is really going to be a hot topic for you, another hot topic is always do spay pregnant things. If that's going to be a hot topic for you, maybe don't be around when we're going to be doing spays and neuters on the off chance that one of them is pregnant and it's going to affect you in a way that you're not happy with. So think about those things. Find your work-life balance. That one, that's a good one. I still haven't found that, so I keep working on it. The only saving grace I have is that I know when I leave work at 5 o'clock is that like between 5 and 7 it's my time, and then after that it's who knows what will happen. So even if it's just a few hours a day, find that balance in there, okay? And then have fun. I'm not saying go out and like have a rager, but do stuff that's fun. Go hiking. It's really beautiful here. This is my first time in Kentucky, by the way, so it's really beautiful. There's lots of things that you guys could be doing around here, I know. So a bunch of helpful resources that I really like. The AVMA has a work and compassion fatigue worksheet that you can go through. They also have a self-care sheet where you can like put on there things that affect you in certain ways, or like it's like a scale, you can do all these little scales and it really helps you decide what's affecting you most in your life. The Compassion Fatigue Awareness Project's another really good online resource. And then the online course through University of Florida, I actually just got an email about this one. It's about how to navigate compassion fatigue, how to help others with compassion fatigue. So if you have the opportunity to take the online course, I would definitely recommend it. Jessica Dulce teaches it. She also has a really great website too. It has lots of good resources, so look into that if you have the time. So briefly, I want to talk about the suicide crisis. It has hit the veterinary community pretty hard recently. I think Sophie was the first one that really kind of like struck our community. And I have some statistics that I want to read you guys. JAVMA, which is the Journal of American Veterinary Medical Association, they had posted a study in 2015 that was concerning depression and suicide in the veterinary community. And it was one of the first mental health studies that they did in the United States. It showed that 1 in 10 veterinarians may be experiencing significant physiological distress and or depression, and that 1 in 6 doctors have considered suicide since graduating vet school. That is an astoundingly high number. I can't say that that is directly related to compassion fatigue, but what I can say is that I do think it's related to us bashing each other on the internet, us getting on social media and being harassed about stuff that, I mean, you guys have probably seen it with your shelter stuff. You post a picture of an animal and then 20,000 people post on it and say you're a terrible person for doing whatever. So that happens to everyone in our community, right? So that's why I bring up this point about suicide, that it's not just veterinarians, we just happen to be the ones that they looked at because it was popping up heavily in our community. So my point of this is that as a community, we are here for each other. We have to be here for each other. We have to have each other's backs. So if at any point anybody in this room ever feels like they need help, call me. I'll be happy to give you all my personal cell phone number. Just call me. She's got it too. Yeah. The reason why suicide really hits home for me is that my grandmother and my uncle both committed suicide, so it's a big deal for me. And being in vet school, I lost one classmate and I have a senior student that struggles, so that's why it's important. So this is just a quick recap about compassion fatigue, right? So the warning signs of compassion fatigue are going to be unusual moodiness, increased emotional outbursts, not working well with other people, isolating oneself, calling out of work, missing school more frequently, excessive complaining, lots of complaining made about someone else in the building. Once the compassion fatigue is recognized, what are we going to do about it? We're going to talk to people, right? We're going to talk to a counselor, a coworker, a priest, rabbi, I don't know, whoever, anybody. Don't take work home with you. Try to unplug the best you can. Make sure you take breaks. And then how do we prevent it altogether? We're going to increase our self-care in order to maintain our physical and emotional health. We're going to make sure that we're exercising, eating well, drinking plenty of water, getting lots of rest, having fun, all of those things. So do you have any questions about compassion fatigue before I jump into the more heavy topic? If not, we can, yeah.
One other resource, the ACC&D, Alliance for Contraception for Cats and Dogs, did a big think tank around what they call moral injury, and I think it's out there now, and they have a whole worksheet.
Awesome.
An evaluation tool, also a really nice one to go through.
That's awesome, yeah. So I think there's plenty of resources. I get that one added to my list too, but yeah, there's lots of online resources, and Amanda and I were talking earlier today, like there's got to be there's all these online forums and discussion groups for all sorts of groups that really there needs to be one for us for that. I'm sure there is, but we talk about that a lot. Maybe we need to like start one for shelter or welfare type settings. So euthanasia, it's a super hot topic. It brings up a lot of emotions in people for lots of reasons. Something that always astounds me is that in vet school, I really didn't learn a lot about euthanasia at all. I didn't learn about the emotional aspect of it, how to deal with clients, how to deal with the pets. And then when I came to shelter medicine, I was completely blown away by some of the methods that I was hearing that people and veterinarians were euthanizing animals. So I stopped that where I am at. I spoke at a euthanasia conference, and I knew people in the room who were doing things very inappropriately, and I spoke out about it. I didn't call anybody out, but I made it very clear what was the law and what was the AVMA guidelines. You know, even though the AVMA and the ASV, the American Association of Shelter Veterinarians, they're not governing, you know, like you can't get in trouble, but they are guidelines. And as a veterinarian, I'm a member of the AVMA. So the AVMA euthanasia guidelines are important to me, and I do follow them. So that's kind of where all of this came from. Of course, I did euthanasia prior to coming back to the vet school, and one of my most prized moments was that I had an owner call me. She had an Airedale, and it was incredibly aggressive, and she called me 3 times the day before the euthanasia appointment, and she said, "Please, doc, don't restrain him, don't put a muzzle on him, don't do all these things." And I'm like, oh my gosh, so like, what am I supposed to do? I mean, she's telling me she has to sedate the dog just to groom it herself, so I'm thinking this is going to be a disaster. And to this day, it's my happiest moment. I was able to euthanize that dog without a single ounce of restraint, and the dog never snapped at anybody, never bit anybody, nothing. So my point is that it doesn't matter the type of situation you're in for euthanasia, fractious cat, aggressive dog, you know, the sweetest little pup in the whole world, they all can be given good deaths. So that's kind of the point of this whole lecture. So I want to break it down, first of all, as to what euthanasia actually is. So the Greek words is eu, meaning good, and thanatos, which is death. So it's literally providing the animals with a good death. The American Veterinary Medical Association describes a good death as the use of humane techniques to induce the most rapid and painless and distress-free death as possible. So the AVMA actually defines what this is. So the next question is, why do we euthanize animals? So I'm sure you guys can think of a multitude of reasons in shelter and welfare settings why we would euthanize them. Some of them being to control overwhelming diseases or infections that have struck the shelter. So like canine influenza hit a shelter not that long ago in Florida, and they euthanized all of the dogs. It was the only way that they could break the cycle of that. Population control is one that we hear about. Sometimes we get over our capacity for care, and it can be a difficult situation, difficult decision, but sometimes we have to euthanize animals because we just don't have the space and the resources. And that's when we have to decide, does the animal have a quality of life living in the shelter, or is there some other option, right? I know of a couple of shelters that I work with, animals have been in there for years. And for me, in my opinion, those dogs would be better off not being there than living in a shelter their entire lives. Unadoptable animals or aggressive animals, right? I, in good conscience, could not adopt out an animal that I knew was going to bite a child, right? So maybe those are some things that we would consider euthanizing. And then, of course, relief from any pain and suffering or any disease processes that we're having, right? It's probably not appropriate to have hospice cases in a shelter. So those may be cases where we would also consider euthanasia. So what I did is, Kentucky and Tennessee are unique in that you guys have certified euthanasia technicians, and you also have the ability that licensed veterinary technicians under the supervision of a veterinarian can euthanize. In Mississippi, that is actually not the case. It has to be a veterinarian. Now, that doesn't mean that they don't do, like people don't do it, because they do. But I went through your guys' state laws because I wasn't familiar with them. So what I did is, this is literally the breakdown of all the state laws and the state codes, all of these, where it says like 321.207, that's like the number in the state law of the Veterinary Practice Act, so you can look this up. So in Kentucky, let me make sure I have all of these right. In Kentucky, it can be a licensed veterinarian, a licensed veterinary technician functioning under the direct supervision of a licensed veterinarian. And by direct supervision, that means that a veterinarian is in the building. He or she doesn't have to be in the room with you, but they have to be in the building, and you have to be able to reach them if something were to go wrong. And then also, you guys have the certified euthanasia specialist, which is not something that we have in Mississippi. So if you are going to be a certified euthanasia technician, you get a special license. You take like a 16-hour class. You have a special license, and you also are allowed a special DEA license, which historically are reserved for like veterinarians, doctors, physicians, nurse practitioners. But euthanasia technicians can have one. It's restricted, so you're restricted to the drugs that you can buy, which is basically pentobarbital, the euthanasia drug itself. So then the next thing is, what are the methods of euthanasia allowed for a euthanasia technician or a euthanasia specialist? So in Kentucky, you'll see there that it says pentobarbital or sodium pentobarbital with lidocaine. So those would be the two drugs that you'd be able to order with your DEA license. And then it has a list of the 4 approved methods for euthanasia. One is going directly into the vein. The other one is intraperitoneal, meaning that you're going into the abdominal cavity. The third is the intracardiac injection, but you'll notice a very big caveat, and it's quite important. The animal must be sedated or unconscious prior to doing that. And then the last one is solution or powder added to the food. Because they have that solution or powder added to the food, the powder added to the food changes the game a little bit, so you'd have to look into the DEA license requirements for that particular thing. For the solution portion, you can actually feed your regular euthanasia solution. I stick them in those little veggie caps you can buy, like people put vitamins in them or whatever. The big ones will hold about 1 ml of euthanasia solution, so that's a way that you could give euthanasia if you needed to. We'll talk more about that in aggressive animals. So then in Tennessee, we have similar laws. Certified euthanasia technician, a licensed veterinary technician, and they have that described as being under the care of a responsible supervision. So responsible supervision was a little tricky for me. I didn't quite understand that. But it basically said that the veterinarian is going to take full responsibility, and they're going to have their express professional judgment on certain things. So take that for what it is. It's probably like indirect supervision, where you can make a phone call and the vet would be access for you. That would be my interpretation of that law. So the same thing, you'd have to go through the euthanasia technician course, and then again you would apply for a special euthanasia or DEA license to purchase your euthanasia solution that way. Tennessee has a little less information about methods of euthanasia. However, the one that I want to point out is that intracardiac injection restrictions. That one is quite clear in the law right there. You can see that the animal must be tranquilized prior to an intracardiac injection. The reason why intracardiac is so important to me is that I've heard a lot of stories of people doing it without sedation and holding animals down. That's not appropriate under any circumstance. So that's why I specifically went and looked for these laws, because Mississippi doesn't have those laws. There's nothing listed under our laws for that. So before we do any euthanasia, the first thing we have to do is make sure that animal is not owned by anybody. Look for tattoos, scan it for microchips. Did it come in with any type of collar, some type of identification? Check social media. How many times do we post that Fluffy's missing and then 20 minutes later somebody found Fluffy, right? So make sure you're checking all of those things. Check and make sure when you take the animal out of the cage that you're going to euthanize, it's the same animal that's on the paper, on the cage card, in a picture, whatever it is. Make sure you know that that is the animal. Because remember, there's no do-overs. If we euthanize the wrong animal, that's it. So sedation prior to euthanasia is something that I really prefer. Euthanasia should provide a peaceful, pain-free, and distress-free death. And if we sedate an animal prior to the euthanasia procedure itself, we can provide them that comfort. We don't have to worry about sticking a needle in their abdomen and worrying that they might squeal because something stings them, or if something goes horribly wrong and we can't get a vein, we can stick them in the heart because they're sedated or anesthetized, right? So that's why I personally prefer sedation prior to. So I hear a lot of pros and cons, and I made a list up of all the pros, and then I made a list up of all the cons. So we're going to go through those together. So the first pro is that it's going to minimize distress for the animal. It's going to eliminate any pain that they may have pre-death from any injuries or disease processes that are going on or whatever might be happening. It lessens the danger to people handling the animal. So what if it's a super aggressive dog that is trying to eat your face off? Or a fractious cat that if you blink at it wrong, it's like trying to attack you. That would be less than ideal if you're trying to perform a euthanasia that is painless, distress-free, apprehension-free, right? It eliminates the need for a second person and also eliminates the need for restraint. For me, that was really important because my euthanasia appointments, it was just me. I was the only one that went to those appointments, so those are important. It also increases your technique option, right? So what did I say about intracardiac? They have to be sedated, anesthetized, or comatose, right? Well, if I have them pre-sedated and something goes horribly wrong and I have to do intracardiac, or if that's the method that I choose to do, well, now they're sedated, I don't have to worry about that, right? And it may lessen what we call perimortem side effects, so things like agonal breathing. That's where animals sometimes it looks like they're gasping for air, and it's just the way that their breathing pattern is. And then the cons. The notorious con that I hear all the time is that it's more expensive. So ACE and xylazine are not controlled drugs, and they're not really that expensive, and it doesn't require a whole lot to sedate them. So I kind of always push that one off to the side a little bit, but I do realize that that's a concern. One of the bigger concerns that I hear is that it could alter the body physiology, right? So there's one drug that comes to my mind that I use it in Kitty Magic, right? Dexmedetomidine, and it can cause the veins to constrict, making it a little difficult to locate a vein, right? But if the animal is sedated or anesthetized, I can use other routes. So really that doesn't become so much a con as it would just be we don't use intravenous, we use a different route. Something that I did see a lot of in super sick animals was unpredictable transition into sedation. So a lot of times my patients that had significant heart disease or lung disease or brain tumors or some type of neurologic disease, they would have seizures, or they would have what I call the natural dying process triggered. Doesn't really change anything about what I'm doing. The animals are unconscious as it is, their bodies are just reacting. So if that happened in front of clients, I would just walk them through the process and euthanize the animal faster versus letting the animal stay with mom and dad a little bit longer. The potential for side effects is still a possibility. So like xylazine, if you give xylazine to a cat, just straight xylazine, it's gonna vomit. That's just the reaction that they have to it. So if that's a concern, maybe don't use xylazine in a cat. Use some other combination of a sedative or whatever you want to use. The other thing is it burns or stings the patient. That's something I hear a lot, and it is something that has crossed my mind when I've given cats Tilazol, for instance. Sometimes the younger ones will scream. I'm sure it burns, but it's a heck of a lot less painful and hurts for a lot less period of time than a needle directly to the heart without sedation, right? So these are just a few sedation protocols that I have used in the past. The Humane Society of the United States, or HSUS, they recommend using a mixture of xylazine and ketamine, or just using tilazol. Xylazine and ketamine given together in the muscle, it takes like 3 to 5 minutes for the animal to become sedated, and they'll be unresponsive to pain at that point. Tilazol is a combination of 2 drugs. It's tyletamine and zolazepam. It takes about probably 5 to 10 minutes to eliminate an animal's reaction to pain and to render them unconscious. And then the combination I used most commonly for me was ketamine, butorphanol, ACE, and xylazine, and I would use it in cats minus the xylazine. However, I realized that 2 of the 4 and 2 of the 3 drugs on that list would be controlled drugs and not ones that you guys would be able to have or to administer without a veterinarian. But that being said, you can use xylazine and ACE together, or you could have some other combination of things that might work, and that's where I encourage everyone to have a relationship with their veterinarian, and that if they do have to do euthanasias in that capacity where you have to sedate them, maybe they can be present and help with that. The most important thing to remember is that not all animals are the same. They are not all going to react to sedation the same. They're not going to metabolize the same, so it may take longer for some and may take a lot shorter time for others. So just remember those differences. That's why in practice, vet students, I never leave the room when I sedate an animal for euthanasia, because what if something goes wrong? What if they have a seizure in the first 5 minutes that you've given them the sedation? I want to be present in the room so I can walk the owners through that and they're not traumatized by it. So, signs of unconsciousness. The first, I keep pulling this, I'm so sorry. The first, I just realized that. Some of the signs that you will see once they have been sedated and the appropriate amount of time has passed, we want to make sure that they're unconscious. So unconsciousness is defined as a state of unawareness where the animal is unable to consciously perceive or respond to a normal stimulus, including pain. So an unconscious animal loses its ability to stand as well as their ability to right themselves. So they become what we call laterally recumbent. That would mean that if I tried to put them up on their sternum, they wouldn't be able to maintain that and they would just fall back over. They lose their palpebral reflex, which is if you tap the corners of their eyes, they'll blink usually. They'll lose that. They also lose what we call the corneal reflex, where if you tapped their globe, their actual eyeball, with the pad of your finger or a Q-tip, they won't blink and they won't pull their eye back. They also lose the ability to spontaneously blink or to track things. You know, that's like our infamous, can they see? And you drop a cotton ball. Well, they're not going to be able to do that, obviously. And then what we call the toe withdrawal response will be absent. So that means that if we pinch their toe, they can't pull their leg away. It means that they aren't making that connection to the pain of you pinching their toe and being able to pull their leg away. So that would mean that they are unconscious at that time. So once we've confirmed that, we can move forward with the euthanasia. I want to talk to you guys briefly about the euthanasia solutions. A barbiturate is by far and away the most common drug that we're going to use, and it depresses the central nervous system, creates a loss of consciousness, followed by what I call a plane of anesthesia or an anesthetic event. Right? Pentobarbital, once upon a time, was used as a anesthesia, and we discovered it didn't work so well because some things weren't waking up. So that's how it became our euthanasia solution. From that plane of anesthesia, it creates what we call apnea, where they'd stop breathing. And then after that, they go into cardiac arrest. So pentobarbital sodium is the most common one, Euthasol, that's probably a name everyone's familiar with. And it has something, well, let me back up. So pentobarbital sodium, pure pentobarbital sodium, is the one that most commonly we prefer to use for certain routes of euthanasia. So in some pentobarbital combinations, there's a drug called phenyltoin sodium. And phenyltoin sodium, in the literature, if you read, says that it potentially can cause cardiac arrest prior to loss of sedation or loss of consciousness. So that would mean that the animal is aware and their heart has stopped. I've talked with several anesthesiologists who don't think that this is really something that we see a whole lot of, but I'm just going to put that out there because when you If you are a euthanasia technician and you're purchasing your own euthanasia drugs and you're going to use the intraperitoneal or in the abdomen route more frequently, then you might want to look into drugs that are pure pentobarbital sodium, such as Fatal Plus or Sleepaway. Those might be more kind of the drugs that you want to lean towards. So again, something that astounded me in vet school is that no one ever told me what the dose of euthanasia solution was, ever. It was like just assumed that you knew what it was. So we're going to stop that right now, and I'm not going to assume that anybody knows what it is. And the general rule of thumb is 1 ml of euthanasia solution per 10 pounds. I personally use 1 ml per 10 plus 2 mils, and here's why. I euthanized a min pin with 1 ml of euthanasia solution, and it did not die. And I will forever be scarred by that and will always, always give 2 extra mils of euthanasia solution. I'm sure 1 mil works, 1 mil per 10 pounds works beautifully, but I just can't bring myself to do it anymore. That was traumatic. There are different scenarios and situations where you are going to want to increase your volume. So for instance, intraperitoneal euthanasia, it's a big cavity, right? So there's going to require a lot more euthanasia solution. So if I'm going to euthanize by sticking it into the abdomen, you need to do 3 mils per 10 pounds. Some other instances where it might be smart to increase your volume would be if they have cardiac disease or lung disease, something that's going to compromise the pumping of the solution through the blood vessels. So that would be another time where I'd want to increase my dose. Some different routes. Intravenous is going to be the #1 choice for pretty much everybody in all settings. It's also one that does not require sedation prior to giving. So if you can hit a vein and have someone hold the animal still and well, you can give it in the vein. That's completely acceptable. I personally would use the cephalic vein or the lateral saphenous on the back leg of a dog. Cats, I tended to use medial saphenous, or I personally, as a veterinarian, I euthanize them in their, using the blood vessels associated with their kidneys. I found it to be easier. Or I would just use their cephalic if they were like a chunky cat. Intraperitoneal, this is going to be a preferred method for your neonates or pre-weaned animals or really small dogs that you can't hit any veins on, things like that. And it's going to go, we call it ventral midline. So it's when they're on their back, they have, that line going down their belly, and they have what looks like a belly button. That's their umbilicus. So that's about the area where you would inject that solution. Again, we talked about using a pure barbiturate versus one that may have that extra additive. If you're ever in doubt about that or what's in your euthanasia solution, I would just recommend sedating them prior to giving it regardless. That way you don't have to worry about that. Be aware that intraperitoneal routes are going to take a lot longer. So it's going to take like 10 to 15 minutes for them to become unconscious. And then from that point, it's going to take maybe 15 to 20 minutes for them to pass away. So if you're going to do that, some special considerations are going to be do it and then put them in a dark, quiet place. But somewhere you can still monitor them, right? Because if something goes wrong, we may have to intervene so that they're not laying there having some crazy reaction to something. And then I wrote on there it's not for pregnant animals. Can anyone tell me why it wouldn't be for pregnant animals? Because what? What if I accidentally went into the uterus only? So that's why we prefer not to do that in pregnant animals. So these next few slides are going to sound really like harpy and kind of annoying, but I just want to, I'm going to read this little quote here and remind everyone that I pulled all of this information from the AVMA Euthanasia Guidelines, the AVMA Code of Ethics, and from the ASV Guidelines specifically. And I just want to read to you what the ASV Guidelines say in regards to euthanasia. Any agent or method that is unacceptable according to the AVMA guidelines on euthanasia is also unacceptable for use in shelters. So if you read the ASV guidelines and you read the euthanasia section, it's going to refer you to the AVMA euthanasia guidelines, and they're really amazing. It's a really long document, but if you have time to read it, I recommend it. It's actually very helpful. So methods that are not acceptable. Any other non-vascular route should not be used for euthanasia because they are associated with pain and distress of the animal. Routes that should not be used include subcutaneously, intramuscularly, intrathoracic, meaning in the chest cavity itself, intrapulmonary, in the lungs, intrahepatic would be into the liver, or intrarenal. There are instances where those methods are acceptable. However, the animals must be sedated. So you have to have pre-medded them with something so that they are unconscious. It's absolutely unacceptable by both ASV and AVMA guideline standards to perform intracardiac euthanasia unless the animal has been reliably verified to be unconscious, comatose, or anesthetized. There's a reason for that. It's quite painful, and a quick painful death is not the best death or a good death, so that's really why it's not looked upon highly anymore. This seems like I shouldn't even have to say this, but it happens more than I care to count. The use, what is that? The use of household chemicals, disinfectants, cleaning agents, pesticides are not acceptable agents for the use of euthanasia under any circumstances. Creating a state of hypothermia, drowning, or death by some type of a physical method like disarticulation is not approved without sedation. However, in pocket pets and birds, the rules change. And that's why it's really important to have a copy of the AVMA guidelines, because how they euthanize animals in lab animal, for instance, is quite different than how I would euthanize a cat or a dog. So make sure that you understand the differences between species on that. I was asked to euthanize a bird last week, and I was like, what in the world? And I ended up, the bird was fine, so I didn't euthanize it, but it came into the shelter. It was like a dove. And I was like, what am I going to do? And I thought, well, xylazine and disarticulation. And then I was like, I don't want to do that. Drugs that we call paralytics. These probably aren't drugs that any of you are going to really encounter in your careers unless you're in a vet clinic that does like neuro or eyeball things. They basically paralyze the animal, but they're completely aware of what's happening. So it's kind of like forbidden and condemned if you use this. So any type of paralytic drug as the sole method of euthanasia would be considered inhumane. And if you're going to do it, they have to be sedated. But again, I don't think those are drugs that you guys will readily encounter with what you're doing. And then carbon monoxide. That's something that used to be super common when I was younger. In the 80s, my mom told me that that's how they euthanized our Dalmatian. And I was like, whoa, I didn't know that that was a thing. And it's discouraged now, and it's not acceptable by the ASV guidelines, mostly because it takes a certain level of the gas to enter into the body, and it's not really distress-free. It's kind of like the opposite, actually. And what people used to do is they would group them together and do it like at one time. So imagine having like 5 animals in a box and then gas them down. It's probably not the right thing. So a lot of states, too, have laws against that now. I actually didn't look up your guys' state law, but I can. I have them printed. I can look it up. But it's not something that the ASV guidelines considers acceptable. So again, if intravenous access is not available and intraperitoneal euthanasia wouldn't be practical, because like what if it's a 100-pound Great Dane? Probably not practical to stick that much euthanasia solution into its abdomen, right? So if that's the case, you can use intra-organ euthanasia routes. But again, they have to be sedated or anesthetized or comatose. You have to confirm that that is the case. Intracardiac injections too, just as a side note for the veterinarians in here, they can probably attest to this. Locating the heart specifically for an injection is quite difficult. Maybe not in a cat where you can palpate their heart, but in like a large dog, technically it's difficult. It's based on landmarks and listening and things like that. So if that is something that you are going to do, I would really recommend having a trained euthanasia technician or a veterinarian doing it. I say that because I've heard stories of people going straight through the animal, and that's like terrifying to me. Gunshot. So euthanasia by gunshot is not recommended as a route in small animals for obvious reasons, right? If you use a large caliber gun, that's less than ideal. But also, you have to be really technically good at using a gun. And my dad's a retired chief of police, and I cannot shoot a gun to save my life. So like I wouldn't trust myself with a gun, period. But in emergency situations, it's possible to use it. What we always say is try to use all the other routes first before you go to a gunshot. And then if that's what you have to do as a last resort, then you need to get someone who's really trained at using a gun. And there's, in the AVMA guidelines, there's like diagrams to show you exactly where you're supposed to aim and things like that. So some physical responses to death that you might see, something they call the body stretch, or it's sometimes known as the death stretch. It's where an animal will stretch out kind of really weird. That sometimes is something that you'll see as they're passing. They almost always urinate and defecate post injection of euthanasia and passing. Their pupils are going to dilate. They're going to have that glazed over appearance, kind of like nobody's home. They can have muscle spasms. They can have toe twitching, their whiskers. I've seen their whiskers move for 30 minutes post passing away. Those are all things that you can see. Sometimes we hear air noises or gut sounds. If you've moved an animal that's passed away, when you pick them up, sometimes it sounds like they've exhaled. That can be something you notice. Or their gut noises continue. Remember, their microbes in their gut are still going for a little while, so those are things that you may still continue to hear. And sometimes they do have fluid discharge coming out of their nose. I typically see that in the animals that have heart disease and lung disease. That would be a common thing that would happen. Once the euthanasia process is complete, you really have to confirm death by multiple routes. You can't just assume that because it doesn't have a pulse that it's dead. Animals are really good at fooling people. And I've heard some crazy stories about people euthanizing a pet, and then 30 minutes later the pet like walks away. What? I couldn't even fathom that. So always make sure that you use multiple ways of checking that they've passed. So loss of consciousness. So as we're going through all of this, you have the loss of consciousness, which you may already have from the sedation, right? So if you were going to euthanize intravenous only, it would maybe take a minute or two for them to become sedated, right? And then they would start working on the passing process. So loss of a pulse, respirations are going to cease. They're going to lose that pupillary response, corneal response. They're going to lose that toe reflex, right, where you pinch their toe and they withdraw back. Their heartbeat is going to be absent. So remember that just because they don't have a palpable pulse does not mean that they are in cardiac arrest. So it's really important that you have a stethoscope and you listen to their heart. And I personally always listen on both sides. It's probably my paranoia. That's just something that I do. So the important thing here to remember is that you use multiple methods to check. Briefly, I want to talk about aggressive animal protocols because this is something I think we see a lot of in shelters, or it's something I get a lot of phone calls about in shelters. You can give euthanasia orally. It's not enough to have them pass away, but it's enough to sedate them so that you can get your hands on them. And what I do, I have before injected it straight into like steak, and they won't eat it because it's like sticky and gross, and I'm sure it tastes terrible. So what I've done is I've stuck them in those jelly caps. I just inject it into the jelly caps and make a meatball, and then I have them, like if it was an owner, I have the owner fast the animal for 24 hours and they gobble up the meatballs. That way we don't have to get anyone stuck in a pickle with aggressive pets in cages and things like that. Also with cats, I said can be squirted into their open mouth. Cats don't eat things. You guys notice that? They just don't eat things. They're smart. But if you have a fractious cat that's like hissing at you, you can squirt euthanasia into their mouth, and it will be enough to knock them down. It won't kill them, but it will be enough to like calm down, little guy. So that's one thing. If that's like last resort though, I don't like doing that.
Does that make them salivate?
It does. It makes them do that weird bubble drooly thing.
Okay.
That's why I imagine euthanasia is probably like bitter.
Actually, so because it's so thick, either use a really large bore needle or drop the volume that you want to give and then drop some water
Dilute
in
it.
it to dilute it, and that'll help a little bit with the salivation component too.
Oh, yeah. I also give gabapentin to cats. I load them up on gabapentin. And it, like my cat gets 25 milligrams and she is out. So I'm like, 300 milligrams, that sounds good. And you can sprinkle that on food and they'll eat it. And then it's like they get a meal and then they take a nap. So I feel better about that, right? I shouldn't tell you guys those things. Special considerations. So this holds true for all the students in here that are going to go into GP. You want to have like designated quiet spaces for euthanasias. You don't want this to be a high traffic place. You don't want there to be lots of loud noises going on. Keeping cats that are feral covered is really important because it's kind of inhumane to keep feral cats in a cage in the middle of a room with no cover on them and they're like, my whole world is flipped upside down. So if you're going to do this with feral cats, make sure they're covered. You want to prevent other animals from hearing or witnessing the euthanasia process. Now, this is kind of a weird thing for me because when I did in-home euthanasia, everyone always asked me, should Fluffy be in the room while you're euthanizing Fido? If Fluffy wants to be in the room, great. If Fluffy wants to leave, let Fluffy leave. And something that I always notice with them is that they actually would dismiss themselves at some point during the euthanasia process. I had one owner who asked me, she didn't want to be present, but she wanted her other Westie to be present. And I had to hold this Westie while I euthanized the other Westie, and it was freaking out. So if in GP type setting, if the animals want to be present, great. If they don't, I don't make them be present. So in a shelter setting, it would probably be wise to just not have other animals present in general. Don't just walk up to a kennel of 20 and then run in each kennel or whatever, however the setup would be. Maybe that's not the best way to do that. If you are going to euthanize any mother animal with her litter of puppies, there's lots of reasons you may do this. If it is something you're going to do, euthanize the mother first and promptly euthanize the babies after. If you euthanize the puppies prior to mama, she's going to be really stressed out and it's going to be really upsetting to her, and that does not equal a distress-free, apprehension-free, painless death, right? Again, intraperitoneal. Place them in a dark, quiet place where you can keep an eye on them because it does take a little bit longer for them to pass when you use those routes. And I just want to bring us full circle back to compassion fatigue. We've already talked about some of the things we can do to help alleviate stress of euthanasia on ourselves. And one was to share responsibility. Consider having a rotation of people who are assisting with the euthanasia procedures, or if you are a euthanasia technician, maybe consider not doing euthanasias like every day. Maybe do them like every 3 days or something like that if that's a possibility. Or recruit a veterinarian to help you as well. And I mentioned earlier in this portion of the lecture that euthanasia can be a really hot topic for some people. So don't force employees into doing things or into assisting you because that's only going to create a lot of interpersonal stress and just it's not good for all involved. I think that creates a lot of tension and it's already kind of a tense situation when you're euthanizing pets anyway. Have set guidelines on how you're going to decide when an animal is going to be euthanized and how you're going to perform those euthanasias. In your 2 states, Tennessee and Kentucky, you have those laws kind of outlined for you if you're going to do euthanasia technician route. So that's actually kind of helpful, I think. And provide training and education to your staff members and make sure that appropriate techniques are being used. Make sure everyone's taking care of themselves mentally, emotionally, physically, right? And then I also think something that's really important for us to remember is that each animal should be treated with dignity and respect, no matter their status in life. And I would argue that maybe the animals that we deal with need people and compassion more now than even owned animals because they are homeless and they don't have anyone that cares about them, right? I mean, we care about them, but they don't have an owner that's willing to hold them and let them pass peacefully. So I just want to reiterate that they deserve a painless and distress-free death. And I truly believe that when we provide that for these animals, we also bring some peace and comfort to ourselves, and that's going to help relieve us from slipping into compassion fatigue to some degree. Some take-home points. Euthanasia is using humane techniques to induce the most rapid, painless, and distress-free death possible. Intravenous and intraperitoneal injections of barbiturates are preferred methods of euthanasia in shelter and animal welfare settings. Animals that have more fragile veins, such as neonates, pre-weaning aged animals, the intraperitoneal route is going to be preferred. If alternate routes are going to be used, they have to be reliably verified to be unconscious, comatose, or anesthetized. Once an animal's been euthanized, confirmation of death must be performed using several different methods. Special situations such as aggressive pets, pregnant, neonates, of nursing animals. Remember that one size does not fit all amongst all of those categories, right? So everyone's going to be a little bit different in how you treat them and volumes you give and routes that you use. And then, of course, make sure that you guys take care of yourselves, right? Your own health and your own well-being, and make sure that you are not consistently being exposed to stressful, traumatic situations. And if euthanasia is a hot topic for you, let's talk about it and talk with your staff about it, okay? Again, these are just the guidelines that I used. There's a really good veterinary euthanasia techniques book if you're interested in having something with you. But the AVMA euthanasia guidelines are super helpful. I mean, it like has diagrams and exact things that you would need to do and how to do things. So something that I would keep handy in your facilities if you have access to it. It's free online, anyone can have them. So I just want to say thanks. It's a heavy, depressing topic, and I don't bring it up to bring everybody down, but I think it's really important for all of us to understand the different techniques and the different routes and methods and why we choose certain ones over other ones and things like that. And also back to the other lecture, compassion fatigue. If any of you ever need anything at all for any reason, please call me, email me, smoke signals, whatever. Somebody can get a hold of me and I will be happy to talk to anybody. And the same for euthanasia. If you have a difficult case or you don't know what to do, just call me or email me. I have one of the animal control guys from Memphis emails me all the time about aggressive animals, so I'm always happy to help. Any questions? Yes.
Since there isn't a law to govern the wrongful euthanasias, what other repercussions are there for DVMs, LBTs that don't do it correctly?
It's a misdemeanor in, I think, both states, if you got reported to the board. I'd have to look it up. One state is a misdemeanor. Mississippi, there are no repercussions. You could go to the board and say crazy stuff and nothing would happen. They just don't have laws about it. I can look it up for you though. I printed them out up there. I read through those things so much. That's why I asked about the rabies thing. I was like, what? Because rabies law is not in the vet practice. It's a separate set of laws. Yes?
I think going back to that, it does depend on the state. In Tennessee, you go before the vet board, and
Yeah.
there, I don't know if there are criminal implications, but there's definitely.
Yeah. There's usually like a hearing, and then the board has like 15 days or 30 days to come to a decision, and then if they decide to take legal action, then it's like, some states it's a misdemeanor, like in New York it's a felony. There's like, in every state it's different. Florida's really strict too on their laws. But I can certainly look it up and let you know exactly, because it'll have like all those numbers. It'll say reference this one, and it'll tell you what the repercussions are. Did you have a question?
What's the difference between food animal operations and how they cause death there in euthanasia, and then what are the requirements in Kentucky, if you know them, for the technician? The euthanasia technician.
For euthanizing food animal? Or in general?
For the one that you talked about there, the special person that can do the euthanasia.
So in the laws, it specifically states non-food animals. So we have to research further what they mean by that portion of it. But you wouldn't want to use euthanasia solution in a food animal, right? Because that's for human consumption. So we don't want to put pentobarbital into a cow, for instance. And there are laws and rules regulating how we euthanize the food animal ones. And the AVMA has lots of rules, like, for instance, if a cow is super stressed when it's coming through a cattle chute, you can't euthanize it. You have to like run it through again. And I don't know if you guys have heard of the name Temple Grandin. She kind of, she's a very sweet woman. She kind of like changed the way that we view food animal in general and how we run them through different processes for euthanasia. So the captive bolt is probably the most common one used in cattle. Chickens, they do this new thing now. I have a friend, she does poultry welfare, and they've developed these gas chambers now where they gas them in such a way that they just like sit down in a little chicken position and then they just like fall asleep. I'm not really sure all of the technicalities of it, but it's very different than how we do it, right? Because we're doing chemical euthanasia, whereas they're trying to preserve the meat. As far as the euthanasia technicians doing it, I don't think it would be something.
No, I just meant what is required education.
Oh, so it's a 16-hour course, and it's deemed by your state, whatever your state approves for you guys to take. And then they sign this piece of paper for you, and then you apply for a DEA license. When you apply for that DEA license, make sure everything on it's correct, because they are so expensive, and if you mess it up, you don't get a refund. They make you apply for it again. So you would apply for that, and then once you have that DEA number, you get an account with like MWI or something, and that's how you would order your euthanasia solution.
Are there any euthanasia techs in there?
Was it 16 hours? 16-hour course? Yeah. And your DEA license, did you pay for it, or did like the city pay for it?
County pays for it.
Okay, perfect. Because they're pricey little
Pay for the
stinkers.
shelter, and then I also have one. There's
Perfect.
Shelters
Yep.
covered and whoever is certified.
Yep.
And it's $50 a year.
Oh, that's not that expensive. Mine was $800.
It was a 3-day course, 2 full days.
Yeah. Awesome. So yeah, you know what I'm talking about, like trying to share the love amongst having to do that. It can be very taxing if you guys are the only people in the shelter that are doing it. So it's tough, especially if you're in those counties where you don't have veterinarians, right? Like you have to do what you have to do. I know it's tough, but call me. I'll hug you.
Real quick, Erica, can you speak to pediatric euthanasia? Any special, anywhere from, say, gestational all the way up through like a year of age? Any
Sure.
special requirements or considerations?
Sure. So I deal with a lot of pregnant animals that I will spay when they are pregnant. So the way that we humanely euthanize them is that we never open up the uterus to the air. Once you expose them to air, they gain consciousness, is how we describe it. I have a really good paper. I'm glad you brought that up. Someone did a ton of research about this, and there's an awesome paper out there, which is kind of the basis for how we euthanize now. So we place 3 clamps, making sure that they are never exposed to air. The puppies and kittens are already anesthetized because we've sedated them via mom. And then once we remove the blood supply from them, they can no longer metabolize the drug. Their little fetal organs are not in a place where they can metabolize out drugs. Most of the ones that we use are metabolized in like the liver and the kidneys. And then they become hypoxic. So they pass away via hypoxia, meaning that they don't have any oxygen in their blood. But they are anesthetized during the whole process, so they are not aware that it has happened. So that's how we deal with neonates, or gestational. Now, if for some reason the uterus was opened and now the animals are like alive, we would individually euthanize those animals with like a 1/2 ml of euthanasia solution intraperitoneally. In the wee babies, we prefer intraperitoneal. Even in smaller kittens, we'll go that route. Puppies, the same. Puppies are really juicy in their abdomen, so sometimes there's debate on whether or not it's if the efficacy is the same, or if you need to add more volume or something like that. In those cases, if you're in doubt, just increase the volume. It's not going to hurt anything. And then the second thing would be, you don't have to sedate those ones, the tiny ones, right? If you're doing intraperitoneal, IV and intraperitoneal are the 2 routes that you don't have to have sedation for. You're likely not going to hit a vein on anything really tiny like kittens and stuff. Those are going to be really difficult, so I would go with intraperitoneal. Probably from like, I don't know, I'm going to throw some numbers out there. Maybe 4 months on, you could probably hit a vein on them. So that would be my preferred route. And then cats, I personally like intrarenal. I started doing it when I was in practice doing euthanasias, and I love it. Now, if it's like a fat kitten and you can't get its kidney, that's probably not going to be the best route. And if you're going to do intrarenal, I would recommend having some extra training with your veterinarian on that, because if you, for instance, injected the euthanasia solution and you went too far into the kidney, you just shoot it right into the bladder. So you have to make sure that you're in like the meat of the kidney where it catches the vasculature itself. So those would be kind of my only caveats. I don't ever do intracardiac, me personally, unless it's like super emergent and I know the animal is comatose. That's the only time I've done it. That's it. Any other questions? Thanks for hanging in there. It's a tough topic.